So my name is Dr. Peter Wood. I'm an obstetrician and a gynaecologist here at the Sydney Adventist Hospital, and I've been working here since 2009. Very occasionally an emergency might happen. There might be some bleeding, or there might be a problem with the baby's heart rate, and your midwife or obstetrician will advise you of that, and usually there's time to discuss what needs to be done. There might be a need for an instrumental delivery, there might be a need for an unplanned caesarean section. And these can still be done in a positive way so that your birthing experience is still a very memorable, positive occasion. We're fortunate here to have access to excellent anaesthetists that are on call 24 hours a day for us. So should an emergency or a need for an epidural arise, then we have access to that all the time. We also have access to the operating theatres in a timely and prompt manner, and if an emergency happens, it can be done very quickly should an operative procedure be required. Very rarely is there an emergency where we have to go screaming down the hallway. Those situations are so obvious and you would usually know it, and they would happen maybe 1 in 1,000 occasions. So it's not very common. There's usually plenty of time to just discuss the situation and to make appropriate decisions, and you would be involved in that decision-making process. We also have a wonderful group of paediatricians and neonatologists who are very experienced in looking after babies in all aspects of neonatal care, including if the babies are born even as early as 32 weeks, our special care nursery can generally manage babies at that time. If an emergency happens and a baby's born earlier than that, we can stabilise the baby while the NETS team comes in to transfer your baby to an appropriate neonatal intensive care. Fortunately, those situations are not very common.